I am Dr. Leslie Schmidt, Chairman of the New Mexico Board of Chiropractic Examiners. I will be acting as the presiding officer for this rules hearing. The purpose of this hearing is for the board to receive public comment on proposed amendments to the board's current rules and regulations. 60.
So the New Mexico Board of Pharmacy is opposed to much of what's on this formulary. In particular, injectable drugs. None of those were approved by the board. Neither were many of the amino acids or much of the formulary was not approved. And so I'd like to leave it at that.
And essentially what is the jurisdiction of the medical board and the pharmacy board is to approve a formulary that includes dangerous drugs and controlled substances that are injectable, or especially those that are injectable. That's our reading of it. I may not have it verbatim. We did meet with several of those substances. We find it very unusual, and we really do not understand how the board, your board, is rationalizing allowing those drugs to go forward when the statute specifically says if it's a dangerous drug, then the medical board and the pharmacy board has to approve. Therefore, we unfortunately, and we do say unfortunately because we like our working relationship, that we do have to oppose much of your formulary. Thank you.
I'm Dr. Lafarge of the medical board. Back in February, we did submit to you a list, and I believe it's included in your materials, of those drugs which we feel, and we were by definition, came under our purview to review, and we sent you a list. Most of what we have excluded have been intravenous, intra-articular, injectable substances, and we did submit a list which says the ones that we would agree were okay to use in advanced practice chiropractic.
Thank you.
Would like to speak.
Dr. Schmidt, members of the board, Linda Trujillo, and I'm the director for the Boards and Commissions Division, speaking on behalf of the Regulation and Licensing Department. And again, I reflect the sentiments of Lynn in that this board has done an extremely good job of working and reaching out in a very respectful fashion with the pharmacy board and with the medical board. And that in itself is greatly appreciated by the department. That has not been the case in some cases, and so this is really well received. However, the department would like to state that we also ask that this board not approve of drugs, substances that are not approved by the pharmacy board and by the medical board as required under statute.
Comments submitted and discussed heard during the rules hearing will be considered and discussed by the board and during the open meeting following the rules hearing. The board will vote on the proposed rules during the meeting. Members of the audience
Will change.
Why did I have to come here today to find that out when I have a letter in my file from April that said I'm allowed to do it? So I am basically practicing incorrectly. And I don't know it until I come to this session.
Bill.
We were under the assumption that statutorily a definition that allowed you to administer would include injection. We have, after public and private discussions, realized that that interpretation of the statute was incorrect, and that by definition of the same part of the Drug and Cosmetic Act that this statute was included in, dangerous drug includes anything that's injected. By it being a dangerous drug, it falls under paragraph B. Our interpretation will be toward the end of the year.
So then, if I understand, then the only things that we're currently legally to inject then are the substances listed in the statute.
No.
Bill. I have a question.
Let me answer Gretchen's first, please. No, we would actually be eliminating any injection until we can come to a consensus on the training and the collaboration in those injectable items.
So those people then that are injecting now, based on the statute, are practicing illegally?
I think based on the statute and the way it was written, are indeed in violation. In violation.
I've never been involved in one of these processes before, but I think if I understand it correctly, the board just managed to wipe out half my practice overnight. I do a large amount of procaine injections using neural therapy and some trigger point therapy. Had virtually no problems, excellent results with the patients. I was informed by the board I could do this. I gradually converted over to doing a lot of it. Still, of course, in chiropractic and nutrition and things as well. But why was I led to believe this was okay, and now all of a sudden, boom, it's gone overnight? Can the board not reconsider at least allowing those basic core things that we were allowed originally to stand while this is all worked out? Can that not be done? Can that not be put in as a proposal or an amendment until this is all worked through? Because we were authorized to do it. I've now changed my malpractice insurance, as many other doctors have done. Well, why can't these basic core few things that were allowed in the statute be allowed to remain until the boards, all the different boards, get these things worked out? This is going to put considerable financial hardship on a number of us that have had our practices move in this direction. We're getting excellent.
And I will continue the amendment to include the substances contained in statute. 1, sterile water. 2, saline. 3, Serapin or its generic. 4, caffeine. 5, procaine. 6, epinephrine. 7, homeopathics, for prescription and injectable use. I move to accept the substitute chiropractic formulary as outlined in the approved amendment.
Second. I have a second. All in favor?
Aye.
Opposed? So moved.